All right. So we're going to get started now. Hi, and I want to thank everybody for joining me tonight on our live webinar. My name is Dr. Marc Adelsheimer, and again, I want to thank you and thinking about a nicer place. So I kind of like the background of being on the beach as opposed to being in cold, snowy Pittsburgh. I'm going to start our presentation now. So I'm going to share my screen with everybody and start with our slide presentation. Okay, so again, the title of tonight's talk is How Do We Avoid Surgery and Reduce Pain? We're going to be talking about regenerative treatment options using your own platelets and stem cells. I'm going to spend a little more time tonight talking about treatment of lower back. However, we're still going to talk about all of the different regenerative treatments that we do in our practice and how we kind of got there. So first, to introduce myself, my name is Dr. Marc Adelsheimer, and there's a nice picture of myself. I did my undergraduate degree at Duke University, my medical degree at the Medical College of Pennsylvania, my residency at Tufts University in Boston, and then I moved back to Pittsburgh in 1996, and I've been living here and practicing medicine ever since. In my spare time, I like to play some golf. This is a picture of my two partners, Dr. Paul Lieber in the middle and Dr. Jesse Sally on the side. And we have 5 different locations in the Pittsburgh area where we see patients. Our main office is in the Fox Chapel location, and that's where we do the bulk of the procedures that I'm going to be talking about tonight. However, we also have satellite offices in Bridgeville, Washington, PA, Sewickley, and in Monroeville. Before we even get going on tonight's talk, I wanted to just first talk a little bit about the fact that our practice is 100% CDC compliant with COVID safety. And this is something we have been doing since the beginning of the pandemic and will continue to do. Every patient will be monitored appropriately. Everyone needs to be masked. All the staff are masked. All of our temperatures are measured on a daily basis, as are all of our patients that come to see us. So coming to see us is a very safe experience, and that is something everyone has to feel is very important, especially during the pandemic that we're all experiencing. So why are you here tonight? Why are you here to listen to me? What are we going to talk about? You're here because you have pain, and we're trying to look at other options, how we can avoid that. You don't want to rely on medications. You don't want to have to learn to live with this. You want to avoid surgery. Maybe you're not a surgical candidate. Maybe you don't have time in your life to take care of all these things. Or more importantly, maybe you just want to improve the quality of your life and things that you want to do. So again, that's what we're focusing on. How do we improve quality of life? Whether it's sports or just hanging out with loved ones, and how do we all have a better happiness and be able to experience a better quality to our lives? So this is a brief overview of tonight's talk. I'm going to talk about Regenexx, which is the name of our practice, the name of the company that we do our stem cell work with, different options that we have within Regenexx. I'm going to talk about interventional orthopedics, which is what we are doing, how Regenexx is different than other providers, who is this for, and some of the results that we have. So let's first talk about Regenexx. Regenexx is a company based out of Colorado where orthopedic stem cell injections were first invented. It was founded in 2005, and it was the first clinic on earth that began doing stem cell work. It's a national group of providers. So again, it was started in Colorado by Dr. Centeno and Dr. Schultz. And about 9 years ago, they branched out. And in fact, our Pittsburgh clinic was one of the original Regenexx providers outside of Colorado. Now there's 65 different clinics around the country, and every Regenexx provider is an MD or a DO. Everyone is trained the same way. Everyone has been out to Colorado on multiple occasions, and we're all trained to do interventional orthopedics, including prolotherapy, PRP, and stem cells. So whether you're seeing me in Pittsburgh or seeing one of my colleagues in Florida or in California or Colorado, you're going to be getting the same high quality treatment that Regenexx has to offer. Regenexx is not a product, but it's a family of medical procedures that, again, we are considering a new medical specialty, and this is interventional orthopedics. I also wanted to just pause for a second to say I will have plenty of time at the end to answer everybody's questions. So please feel free to write those down, to put those on our chat line, and we'll be able to make sure we get to every question that we are looking at. So feel free, don't worry that your questions will definitely be answered at the end. Regenexx is also not adding on to an existing surgical procedure, but instead a new way of approaching orthopedic problems. So again, what is interventional orthopedics? Everyone knows what orthopedics is, that's surgery. We're not talking about surgery, we're talking about less invasive procedures to avoid more invasive surgeries. Let the body heal itself. So how can we, instead of cutting things out, instead of surgery, how can we enable your body to heal itself? Surgical orthopedics will not be the dominant form of care in the 21st century. Most meniscal surgeries have been proven to be done incorrectly or for the wrong reason. 95% of meniscal surgeries, they are actually removing a piece of the meniscus, which is leading to arthritis. There have been multiple studies in the last few years showing how this not only doesn't help, but actually causes harm. And this is just one example of one of the procedures that we can now do interventionally instead of with surgery. So let's stop cutting things out, and instead let's start injecting some biologic agents that can help tissues to heal. So this is kind of where orthopedics was in the year 2000, meaning almost everything was done surgically and very little with interventional injections. By 2015, this gap had bridged a little bit, but this is what the future holds. By 2030, approximately 67% of current orthopedic surgeries will be replaced by interventional procedures. And that's what we're talking about here tonight. That's what we're currently doing here in Pittsburgh, and we have been doing now in our practice for over 8 years. Also with Regenexx, the fact that we're all trained to how to do specific procedures, we're not blindly sticking needles and hoping we hit the right location. Blind injections are what almost every physician is trained to do in medical school and residency. A few physicians go on to have more accurate training where they can get a needle into a correct location, but very few physicians are trained for precisely guided injections using musculoskeletal ultrasound and using fluoroscopy. And every Regenexx physician has been trained appropriately to place needles in the exact locations where that's necessary. So Regenexx physicians have different treatment options, and we're going to go through these in a lot more detail. Not really going to talk much about prolotherapy, but we're going to spend more time talking about same-day stem cell procedures and on PRP and platelet lysate procedures. However, prolotherapy is where everything started, and that's a sugar water-based solution that does date back for almost 50 years and is what we call the grandfather of regenerative medicine. We still use it as part of our stem cell procedure. And when I go through what's involved with the stem cell procedure, you'll see where prolotherapy is still an important part of our practice. So let's start first talking about platelets, or PRP. Platelets are a blood cell. They contain healing growth factors. They help to speed up the repair of tissues. They also contain serotonin, which is a product that helps to reduce pain, and they also attract stem cells and help to activate them. We use platelets in two different formulas. One is, sorry, let me back that up. One is for platelet-rich plasma, which is concentrated platelets that we'll use into joints, tendons, ligaments, and cartilage. We also use platelets when we're doing nerve injections, specifically spinal injections with something called platelet lysate. And that's when we'll take your platelets and actually freeze them and lyse them to release all of the healing enzymes in the platelets. This makes the growth factors immediately available to help with the healing process on a much quicker basis. So this slide shows the difference between standard PRP, which you can get in any orthopedic surgeon's office, versus Regenexx, and we call it super concentrated platelet, or SCP, because we're able to concentrate pure platelets and reduce all of the red cells. So as you can see, the Regenexx PRP or SCP doesn't have a red appearance to it because all the red cells have been removed from the product and you're getting pure platelets. We're able to concentrate our platelets at 20 times the amount, whereas an orthopedic office can only concentrate theirs to 5 to 7 times the amount. And we know this because we used to own that inferior machine to make the inferior product. And since we've become a Regenexx provider, we now have a better PRP product to offer. So what is a stem cell and why do we use stem cells? And again, stem cells are different than platelets. Platelets are a blood cell, whereas stem cell you need to get either from bone marrow or fat. A stem cell is an undifferentiated cell that's held into reserve until replacement or repair is needed. A stem cell has the ability to turn into many different cell types, and that's why using stem cells is so exciting. So the same cell can turn into a cell that can then grow some cartilage, or that same cell can turn into a cell that can grow ligament, or that same cell can turn into a cell that can grow bone. That same cell can turn into a cell that can grow muscle. So that's why it's called a pluripotent or undifferentiated cell. In addition to regenerating or turning or growing new product, it also orchestrates a repair response. And this is probably even more important in terms of the healing aspect that people experience in their joints, is the repair response that stem cells do when placed into an arthritic joint, for instance. Adult stem cells self-renew. So people always ask, hey, if you take my stem cells, what's going to happen? I'm not going to have any stem cells left. Well, no, that's 100% untrue. Your body will regenerate all of the stem cells that we take out within 6 weeks of doing a stem cell treatment. And also stem cells help to provide new blood supply when placed in certain areas, and that leads to additional healing. At Regenexx Pittsburgh, we're discussing adult stem cells, not embryonic. We only use your stem cells, autologous, meaning your cells. They will never come from somebody else. Your cells are taken from your body and then placed back into your body. We use bone marrow derived stem cells primarily. The reason why we use bone marrow primarily over fat, I will discuss a little later in the presentation. So before we get into the different areas of the body that we treat with both PRP and stem cells, I wanted to step back and talk a little bit about the procedures themselves. And that's what this slide reminds me to do. So for a PRP procedure or a platelet lysate procedure, that's all done on the same day. Meaning you come into our office, we'll draw some blood, we take your blood to our lab, we spin it down, and then take your platelets and we'll re-inject them into whatever we're treating. So whether we're treating a rotator cuff, a torn meniscus, a arthritic knee, or wherever in the body or the spine, that will all be the same day if we're just using platelets. Whereas the stem cell procedure is actually a 3-day process. The analogy of the 3 days is like planting seeds in your garden. So the first appointment is done with prolotherapy. As I mentioned earlier, I would get back to that because we still use prolotherapy as an important part of our stem cell procedure. What prolotherapy does prior to injecting stem cells is it tills the soil. It makes the area that we're injecting ripe and rich. It does this by beginning an inflammatory reaction and causing cells to go to the surface to make it ripe and rich. So what you'll experience is you'll come into our office and using most likely ultrasound, we will place this solution. And again, it's a prolotherapy solution, which is a sugar water-based solution. into the joint that we are treating. There's no restrictions after that. You leave, you go home. You can do whatever type of exercise you want afterwards. In fact, most of our patients feel better the night of their prolotherapy because there's a little bit of anesthetic component to the prolotherapy solution. The second treatment is the big day, and that's a stem cell day, and that's kind of what this slide is showing. So first, we need to get your stem cells. Where do we get those from? We get those from your bone marrow, and that's where the needle is showing going into the pelvic bone. The pelvic bone is the largest bone in your body. It's very easy to get a needle onto that bone and very easy to get a needle into that bone. When I discuss this with my patients, this is generally the part of the procedure that most people feel a little uncomfortable with. I often get kind of a lot of looks at me like, it doesn't sound like a lot of fun getting a needle stuck into the bone. I can tell you by personal experience, because I've done well over 1,000 of these, that it is not a painful experience. What you will feel is a pinch and burn from numbing the skin. Then you'll feel a little bit of burning when we numb the bone underneath. But once that bone is numb, you do not feel the needle going into the bone. If you are nervous about that part of the procedure, which a lot of our patients are, we can give you a medication like Valium or Ativan, which would help to relax you for the procedure. But we also have laughing gas in our office, which can really kind of put you in la la land and make you very happy so you don't have any pain at all with the procedure if needed. But again, most of our patients just do this under local anesthesia because that's all that's necessary. Anyways, once we get your bone marrow, we take it to our lab. Our lab is right there in our office. It takes my lab technician about an hour and a half or so to process your bone marrow, during which time you leave. We give you a gift certificate for breakfast or lunch, depending on what time of day you're there. You go get something to eat. You come back. When you come back, we'll have your stem cells ready to go. And based on what we're treating, we will then place the stem cells into the exact location. And again, this is where the interventional orthopedics is so important, that we don't just shove your stem cells, for instance, into your knee. We're going to hit the exact location on the femoral condyle, on the meniscus, on the ACL, on the lateral collateral ligament, or wherever we're treating. So again, we're very precise where we're placing your cells. And it's really important that it's done that way if you're going to have a good result. You can't just shove these into the knee and hope they get to the right location. Anyways, that's day 2. And then you come back usually 2 days later for the third treatment. And the third treatment is done with PRP or platelets. The reason we put platelets in after the stem cells is platelets act like a fertilizer to stem cells. As I mentioned earlier when discussing platelets, they help to make stem cells work better. So again, the analogy of the 3 steps is tilling the soil, planting the seeds, fertilizing the seeds. And just like when you plant seeds in your garden, you don't have flowers the next day. This is not a quick fix procedure. It takes about a month before you start feeling better, and really about 3 months before you're like, wow, this is so much better. And it can be up to 6 months before things peak. It's also very important that all of our patients go to therapy after a stem cell procedure. We have specific protocols that we will give you to take to a therapist in your area. We see patients from all over, as far away as Rochester, New York, from Cleveland, Ohio, from Wheeling, West Virginia, all different parts of Pennsylvania. So they don't have to come to Pittsburgh to have their therapy. They just need to come to us for the actual procedures. First question is it safe? Before we even talk about what we treat, first and foremost, we always emphasize safety. Just as I mentioned earlier, our office is a COVID safe zone. This procedure is a very safe procedure. Everything we do is done guided, meaning every needle we stick in you is done using ultrasound or X-ray. We're never blindly sticking a needle into you. We've never had an infection. We've never had any other complications with these procedures that you can get with surgery. And that's what this slide is indicate. Can you have significant infection with surgery? Absolutely. Can you have other problems like nerve damage, blood clots, even heart attacks, strokes, and death, absolutely, because they're much more serious procedures. Everything we're doing is done with a needle, it's done guided, and is first and foremost extremely safe. And we've publicized an entire article about safety, again, showing a 0 infection rate, which is very important when comparing to a surgical procedure. So I'm going to talk about the different parts of the body, the main areas of the body that we treat with Regenexx procedures. Spend a little additional time talking about the spine tonight because we wanted to give that a little extra play on tonight's webinar. But I'm still going to talk about the other 3 main joints in the body that we treat. I'm going to start with the knee. And the reason why I'm starting with the knee is just because it's the most common body part that we treat. Why? Because people with osteoarthritis in the knee, even bone on bone, end stage, I need a knee replacement tomorrow, can come in for a stem cell procedure and expect to have a very good to excellent outcome. Why? It's because of the nature of the knee joint. The knee joint is a hinge joint that has a lot of space in it. So even when people have end stage arthritis, meaning that they have bone on bone, the cartilage has been totally worn away, these patients still have decent range of motion and for the most part, decent alignment. And if you do have decent range of motion and good alignment, meaning that you're not too bow-legged or too knock-kneed, you are absolutely a candidate for a stem cell procedure and can expect to have a good outcome. A good outcome, as the slide indicates, is about 2/3 better, or 66% improvement. We've also looked at, we've done a number of studies Regenexx has on different age groups, and age is not a factor with this at all. In fact, in our practice, we have done a 98-year-old gentleman. We've done 4 patients in their 90s. So age is not a factor at all. Obesity is not a factor either. Some people may be too obese to undergo a knee replacement. We have done those patients with stem cells and they have had excellent results. So again, osteoarthritis of the knee is the most common area that we treat with stem cells because it is a home run. And that's for people that even have end stage bone on bone osteoarthritis. Other conditions that we treat in the knee include meniscal tears. Meniscal tears often don't need stem cells unless a meniscal tear is in the setting of arthritis. So a meniscal tear by itself, say in a younger athlete, which is a very common athletic injury, we will just be looking at a PRP treatment. PRP, or the platelet-rich plasma that I talked about earlier, is generally used for less serious conditions. Things like different tendinitises and small tears. These are very common in the sports medicine community and are being done on a daily basis for our patients that have more minor injuries. So a meniscal tear without catching or locking can absolutely be treated with either PRP or stem cells. When people have severe arthritis of their knee, they always have meniscal tears with them, so we will treat both of those problems. The other main area of the knee that we treat are ACL tears, and this is more for the younger athlete, and they can have a very favorable outcome. It's important that we look at your MRI, and as long as the sheath of the MRI is intact, we can fill that sheath with stem cells and regrow the ACL. And I have a picture of that in a second on my video, a slide of that. Before I get to the slide of the ACL, I just wanted to show a typical patient in our practice. This was Pam. She was a 58-year-old aerobic instructor, had 4 years of severe right knee pain. She had an MRI that showed grade 4 chondrosis. Grade 4 is the worst. That means she had bone-on-bone arthritis. She had pain that was a 6 or 8 out of 10. She wasn't able to work, and she was an aerobics instructor. She underwent a stem cell procedure, and 3 months later, her pain level had gone down to a 1 out of 10. And most importantly, she had improved her life significantly. She had gone back to work, and her pain was 85 to 90% better. Her follow-up MRI did show that she had less chondrosis. It had regrown some of the cartilage. But again, as I mentioned earlier, we're not going to regrow all of your cartilage. Most importantly, her knee was now healthier. Her knee was stronger, so she was able to perform better. Her pain went from a 6 to 8 out of 10 where she wasn't working to a 1 out of 10 and she was working her regular job. And she was extremely pleased. This is the ACL slide that I was talking about earlier. I know everyone's not a radiologist, but if you can see my arrow, I'm pointing to where the ACL is and where it is after a stem cell treatment. This is what a normal PCL looks like. You can see the PCL on both of these. Here, the ACL is torn. There's still just a few fibers. The sheath is intact, but there's not this strong band of ACL that you see in this other slide after a stem cell procedure. Moving on to the shoulder. This is probably the second most common joint that we treat in the body. And we treat a number of different conditions in the shoulder. And these conditions can be treated either with PRP or with stem cells, depending on the severity. In some ways similar to the knee, the more severe conditions require stem cells, where the more mild conditions can be treated with PRP. So if we're looking at a rotator cuff tear, a partial thickness tear or a small oblique tear often can be treated with PRP by itself. A larger tear or full thickness tear, stem cells can not only treat this, but can actually cure this problem. As long as that full thickness tear on MRI is less than 1.5 centimeters, and we will look at your MRI to review this to see if yours would qualify, stem cells can be done and can significantly help and cure that problem. Another very common problem in the shoulder is a labral tear. The labral is a deep ring of cartilage in the shoulder joint, often injured from a athletic injury, something called a slap lesion, and greater than 50% improvement on almost all of our patients. So these are very commonly treated and usually do not require surgery. Depending on the severity of the tear will determine whether or not we're looking at PRP or stem cells. So again, that would be made on an individual basis. Normal tendinitis or bicep tendinosis, anything that ends in itis responds really well to PRP especially. And osteoarthritis of the shoulder, much like the knee, can make a significant difference. So whether we're talking about the main glenohumeral joint or the acromioclavicular joint, more than 50% of our patients have had over 80% improvement with stem cell procedures for arthritic shoulders. This is an MRI example of someone with a torn rotator cuff. You can see where the arrow is pointing right at the tear here. And this is after a stem cell procedure. You can see that there's no more fluid around the joint and that the rotator cuff now has repaired. Moving on to the hip. The most common condition we treat in the hip is osteoarthritis. 60% improvement overall for our patients that we deem to be a good candidate. Now, the hip joint is a little different than the knee joint. As I mentioned earlier, the knee is a home run in that even if you are end stage, bone on bone, I need a knee replacement tomorrow, you can get a stem cell procedure and expect to have a good result. That's not necessarily true for hips because of the nature of the joint. The hip is a deep ball and socket joint. That means that when you do become end stage bone on bone arthritis, you generally have significant range of motion loss, whereas we don't see that in the knee. So I'm not in any way saying that it doesn't work for hips. It works great for the right hip, but you need to come in and be evaluated by myself, by Dr. Lieber, or by Dr. Sally, so we can decide whether or not your hip is one that we can treat. But again, we do treat, the number one reason we treat a hip is for osteoarthritis. The other condition we treat is something called avascular necrosis. And with avascular necrosis, we're actually drilling into the hip and putting stem cells right into the bone itself. Avascular necrosis is when part of the hip bone dies. And if you can put stem cells into that area, you can heal that and have to lead to a significant favorable outcome. So again, 73% of Regenexx Hip patients have returned to sporting activities and had significant improvement for hips. This is just a picture of someone with a vascular necrosis, which is right here. And this is showing a long needle going all the way into the bone where we drilled that in there to help heal that area of dead bone. Okay, so as I promised earlier, I'm going to spend a little more time tonight talking about the spine. The spine is an area of extra interest for Dr. Lieber and myself because we have been interventional spine physicians for 25 years. This is where my background is. This is how I got interested in pain management and eventually interested in regenerative medicine. And for years, I've been treating the spine up until I realized I can do regenerative treatments for it with traditional pain injections. And it was very nice. Someone would come see me and I would do an epidural steroid injection and they would feel better. But then they'd come back 3 months later and their pain would be right back where it was. And it was very frustrating. And that was true whether I was treating their herniated disc, whether I was treating their facets, whether I was treating their sacroiliac joints. And it led Dr. Lieber and myself to hook up with Dr. Centeno and Schultz to say, hey, is there a better way to treat the spine? You know, we're all trained to be these interventional spine doctors, but why can't we do something that's going to make a long-lasting treatment? And it's taken years of research and development, but we now have good treatments for the spine. So whether you're dealing with sciatica, usually from a herniated or irritated disc, a painful disc, whether you have facet joint pain, whether you have ligamentous pain, whether you have spinal stenosis, or if you have something called post-laminectomy syndrome, meaning that you've been operated on and have had a bad outcome, we now have regenerative treatment options for spinal conditions. And we are seeing significantly better long-term results than we ever did when we did our old pain management treatments in the past. So this is just an example of an epidural injection. And the question is, hey, why do we always stick steroids into the epidural space? Why not stick something better in there? So we started experimenting with doing platelets for our epidural injections, and voila, we've had significant better long-term results with platelet injections than we ever expected than we did with steroids. This is just a slide showing that with your average epidural steroid injection, by 3 months, this injection was gone. By 6 months, it's 100% gone. Whereas with a Regenexx epidural injection, meaning using platelets instead of steroids, you will get significantly better long-term healing results. And again, that's what it's all about. One of the other things to point out when treating spine is that when comparing it to traditional pain management, when we're doing regenerative treatments, we're able to do multiple areas at once. So a traditional pain doctor can only do one area one time. So you come in and you have a L5-S1 disc herniation and some facet arthritis, and you have an irritated S1 nerve root, and your ligaments are shot and your muscles are weak. They can only treat one problem, whereas we can treat all of those at once. Because you're not a herniated disc, you're someone with low back pain. And you need to address all of those areas in order to have a good outcome. So our treatments are not just focused on one specific location. We're going to treat all of the areas in your spine. And it's so common. In fact, almost every patient who presents with back pain and pain that radiates down their leg is going to have multiple things that are contributing to this. It's never just one joint or never just one nerve or one ligament. It's always a combination of things. And we recognize this. We have years of experience in treating spinal access pain. And now that we're able to treat all of these areas at once with a better treatment option, we are seeing patients have significant long-term improvement. By long-term, we're talking 6 months, a year, 2 years, and beyond. This isn't for the quick fix that you get with a steroid shot that may only last you for, at best, 3 months. The other big thing to remember when comparing platelet procedures to to steroid procedures is steroids actually cause harm. They are bad for you. When you put steroids into the body, they can lead to multiple problems, specifically osteoporosis and wearing away of the normal lining of all the joints or areas that you are placing them. So steroids are not a benign substance to be placing in. Whereas if we're placing your own cells, if we're taking your cells from one part of your body and placing them in another part of your body, it is extremely safe and only designed to make you better, make you stronger without any long-term side effects that you would get with a steroid injection. So how does Regenexx stack up to other treatments that are out there? There's other people doing regenerative medicine. Some of these are very suspect. Some of these are sham procedures, basically. I'm going to talk a little bit about different products that are out there today, and also saying why what we do is a significantly better product than what else is out there. So there's a lot of clinics that are using amniotic stem cells. They're using basically amniotic fluid from a pregnant woman, or maybe cord blood from a pregnant woman. They're drawing this out, they're freezing it, they're sending it to various clinics around the country, and then they're thawing it out and injecting it into people's joints, and they're calling it a stem cell procedure. This fluid has been evaluated by multiple independent labs, and there are no live stem cells in what they are injecting. They are actually doing fraud. They're calling these stem cell procedures. They're not. They're just growth factor injections, and there's no data to help support this. In addition, the providers doing this are usually chiropractors or not physicians. So they're usually done in a chiropractic office. They're people who took a weekend course. They said, come on out and we'll teach you how to do stem cells. And they're charging outrageous prices for a procedure that doesn't work and has no data or research behind it. The FDA is starting to look at these procedures, and hopefully they will shut these clinics down sooner rather than later. So again, these are not done with guidance. They're often done by a PA or nurse, and the cost can be very significant. As I mentioned, the FDA is now telegraphing its punches, not only on amniotic tissue, but also on fat. I'm going to talk about fat in a minute. The FDA has looked at bone marrow concentrate and has zero problems with it. So everything that we do is FDA compliant. So again, why do we use bone marrow instead of fat? Does fat have more stem cells than bone marrow? The answer to that question is no. Bone marrow has significantly more stem cells than fat does, 10 to 20 times the amount. We have studied this, we've researched it, and head-to-head research done at Regenexx and through multiple other clinics around the country heavily favors bone marrow. So we use bone marrow mostly because it's a better product. You will have a better outcome with a bone marrow stem cell procedure versus a fat stem cell procedure. Also, extracting fat is actually much more painful than extracting bone marrow. And I know that because when we first started doing stem cells, we were doing both, but we've pretty much abandoned the fat because the bone marrow stem cells work so much better. So again, we're able to get about 20 times the number of stem cells compared to what you would get elsewhere. So again, are my stem cells too old? The answer is no. There's been a lot of peer-reviewed data that showed that stem cells absolutely work in elderly patients. Using their own stem cells fared no worse. As I mentioned, your body constantly replenishes your stem cells throughout your entire life. So if we take out a bunch of stem cells from your pelvic bone, your body will recreate those stem cells within 6 weeks. So what that means is that you could come back 2 months, 3 months, 4 months later and get another stem cell procedure, and your body will have regenerated all the stem cells that we took away. Much like if you were to give blood, you can give blood again, a month or two later. So what's the downside? The downside is that this, for the most part, is not covered by health insurance. What insurance will cover are your consultations, your follow-ups, your diagnostic your diagnostics, meaning your X-ray, MRI, any bracing and therapy. What they don't cover are the actual procedures. So, and people ask me the question all the time, why isn't this covered by insurance? The main reason to that, the main answer to that question is that insurance companies, if they can say no, they say no. And that's basically what it is. We've been doing this for over 8 years. We've been collecting data so we can show to the insurance companies that this is a cost saver for them. We know that's the case. We know personally in our practice, we saved over 2,000 knee replacements that haven't been performed. Knee replacements on average cost about $50,000 or more. So close to 10 times the amount of a stem cell procedure. But insurance companies are still slow to grasp onto that because at this stage, they're still able to say no. There's also a lot of politics involved in all this, and we're not going to get into that tonight. But just so you know, insurance doesn't cover the actual procedures. So prolotherapy is the cheapest. PRP, generally, a little more expensive. The spine procedures, depending on what we're doing, can have a different range, and the stem cell treatments, are in the higher end range. And again, we'll go over all this when you come in for a consultation. So in conclusion, Regenexx isn't magic pixie stem cells. It's advanced, precise, and safe interventional orthopedics. We've been doing this longer than anyone else in the United States. We have more treatment options available, and we've published more on our online registry than anybody else. We spend more resources than anyone else stacking the deck in your favor. So how do I get started? The answer to that is just schedule a consultation to see myself, Dr. Lieber, or Dr. Sally in one of our offices. Again, we have 5 office locations. We take basically every health insurance that's out there. So your consultation is 100% covered by your insurance, just like seeing any other physician, just whatever copay you may have. And we will do a comprehensive evaluation, and we'll determine whether or not you are a good candidate for this procedure. We will talk to you about your options. Just because you're coming to see us doesn't mean that we're going to recommend a stem cell procedure. That might be one of the options. That may be what you're interested in, but that doesn't mean that's what we're going to be offering to you. If you're not a good candidate for a certain procedure, we're not going to offer that to you. We will give you your options with data. We'll do a comprehensive and thorough evaluation and let you know what to expect. I did want to mention, and I apologize for not mentioning this at the beginning of the talk, but anybody who watches tonight's webinar and comes in and makes a new patient evaluation in our practice, we're offering complimentary, a bundled package of our 3 stem cell supplements. These are over $150 in value, and this includes our advanced stem cell support supplement, our omega-3 fish oil, and our turmeric procurement substance. Again, if you watch tonight's webinar and you call our office and you schedule a new patient evaluation, you will, and just tell them that you watched Dr. Adelsheimer's webinar and you scheduled a new patient evaluation, we will provide you with one of each of these products. Again, over $150 worth of value in excellent supplements that will help you when you go on to have a procedure. Even if you don't have a procedure, they're excellent supplements. So again, the next step is contact our Regenexx call center to schedule a consultation. This is our number, 412-963-6480. We will schedule you at one of our office locations to see myself, Dr. Lieber, or Dr. Sally, and we will be happy to evaluate your problem and tell you what your options will be. So just call and schedule a new patient evaluation. So now I'm going to open things up, and I'll go away from my screen, and hopefully we have some questions that we can answer. And I will open this up to anybody that may have a question for me. And let's see how to do this. So we got a lot of different people on the line. And again, not seeing the question. So, I'm looking to see if there's, I hope I don't have anybody muted. If anybody has any questions, you know, you can raise your hand, you can participate that way. There's certain questions that I usually get asked, and I can answer these for you. There's something coming on. How long does the treatment last? Oh, excellent question. That was one that I was going to answer. So that's a great question, because, you know, if you do get an improvement, how long can you expect this to last? And, you know, again, we've been doing this here in Pittsburgh now for we're almost at 9 years. We have excellent 5-year data on stem cells, meaning that we have patients that had this procedure done more than 5 years ago and are still doing very good at 5 years. We don't have 10-year data yet because we haven't been doing this for 10 years. We do have a lot of patients that are now 6, 7, and 8 years out, but we don't have the numbers to record to people. But, you know, it's really important to know that you don't just get better at 6 months and then kind of drop off at a year. You're still good at 1 year, 2 years, 3 years, 4 years, 5 years, and beyond. So again, that's really important to think about. We're not looking for a quick fix. You're also not looking to have this redone. Can you get this redone down the road? Absolutely. But of the over 3,000 patients that we've treated in our practice, we've only done a second procedure on 3 patients, 3. And those are patients that did very well. It lasted for about 7 years and decided they wanted to have it done once again. Another question that people may have is whether or not it can be done on both knees, if you have knee arthritis, for instance. And the answer to that is we absolutely do treat both knees, but we don't do both of them at the same time. The reason we don't do both of those at the same time is because if we take half of your stem cells and put them in one knee and half of them and put them in the other knee, each knee is only getting a half a treatment. So it's much better to get your one knee that you decide is more symptomatic healed up first, and then once that's healed, we'll move on to your second knee. So that's the reason why we don't do both of these at the same time. Someone asked about bone loss in a couple of vertebrae. It really depends on what we're dealing with there. I mean, that's in the vertebrae, it's a little bit of a complicated problem. We generally aren't injecting stem cells into the vertebrae. It's because you have a compression fracture, there are treatment options for that. If it's because of osteoporosis, you got to be very careful about sticking needles into osteoporotic bones. So again, I'm not saying no, we won't do a treatment like that for the vertebrae, but again, you have to come in, every thing would have to be done on an individual basis. Next question, is there a payment plan available? The answer to that is yes. We have a lot of different payment options. You would meet with our Regenexx specialist, Kimberly. She can talk to you about that. But again, there are a lot of different options out there. Next one, what's the typical recovery time to get back to normal activities? That's a great question. I kind of started talking about that a little bit, but I didn't go into that in more detail. So if someone were to have a stem cell procedure, again, that's going to take you a little longer to recover than just a PRP, meaning that it takes maybe about 3 to 4 days to get back to baseline. Once you get back to baseline and you start your therapy, we want you getting into normal activities, but we kind of protect that joint for the first 3 to 4 weeks. At that point, we then want you to get more aggressive in terms of doing more aggressive exercise, like running, like climbing, like lifting, lunges, squats, etc. So it's really important that in addition to the treatment that we're going to provide to you for your joint, that you go ahead and do the correct exercise program afterwards. So, you know, when you're comparing this to normal, comparing this to surgery, where you're going to not only be down for several weeks, maybe even several months, we have you back to baseline within a couple of days, and then we have you improving right along. So in terms of trying to time it out, like if you're an athlete, we see a lot of athletes, we see a lot of skiers, for instance, often they'll do this maybe a month before ski season because they know they're going to start improving by that point. You know, so usually about a month is when you're going to be getting into the more aggressive type of activities. Okay, let's hit a couple of these other questions here. How is stenosis of the lumbar spine done? Well, stenosis of the lumbar spine basically means that you have a narrowing of the space where the nerves travel through. So what's happening there is you're getting a squeezing of the nerves, which is causing you to have significant, usually leg pain and back pain. So if you just do an epidural steroid injection like we've done in the past for spinal stenosis, which is one of the most common treatments, you're only going to get a short-term benefit. Whereas the platelets, when you're putting those into the epidural space, it's actually leading to healing of the nerve. So instead of just decreasing swelling, you're actually leading to healing. In addition, spinal stenosis is also caused by facet arthritis and ligamentous hypertrophy. So by treating your ligaments and treating your facet joints, you will improve the spinal stenosis condition you have in your back. So spinal stenosis is one of the most common conditions that we treat. It responds extremely well to stem cell therapy, to platelet therapy. We don't use stem cells in that instance. It is, again, one of the more common areas that we treat with very good outcomes. Just that next question, is the treatment for lumbar stenosis a good alternative to laminectomy? Absolutely. You know, laminectomy means that you're getting operated on. They're going to cut into you. They're going to open that up. You're going to have scar tissue afterwards. You're going to have chronic pain there afterwards. So this is the number one condition that we're treating instead of surgery, using your own platelets to help heal that area. If you're told you're not a candidate for surgery, would you still be a candidate for stem cells or platelets for the spine, or stem cells for other parts of the body? It depends. And the answer to that in the short run is yes. Yes, you're definitely a candidate. I can't say that every condition is a home run for it. You know, everyone needs to be evaluated on an individual basis, but we see a ton of patients that have been to their surgeon that were told they weren't a candidate for surgery. They've had a treatment with us and they've gone on to have a significant improvement in their underlying condition. This is true in the spine. This is true in the knees, in the hips, shoulders, elbows, wrists. So wherever in the body you're talking about, this is a viable and good alternative to any spinal or other surgical option. So I do believe I've answered all the questions that have been typed in. I'll give everyone another minute or two to see if there's any additional questions that you may have. I again wanted to thank everybody for joining me tonight. I wanted to remind everybody to please schedule a new patient evaluation in our practice. Remind them that you watched tonight's webinar and you will be happy to give you our supplement package. It will be something that you'll really enjoy. In fact, I've never had a stem cell procedure and I take those 3 every day. So I do recommend this. Where is the beach in the background? I don't know. I just found this virtual background and figured it was nicer than the cold snow that we're having today here in Pittsburgh, but certainly looks nice. What about the Achilles tendon? Yes, we treat Achilles tendonitis, very, very common problem. If you have a completely torn Achilles tendon, you need surgery. Achilles tendonitis, partial tears responds really well to usually just a PRP. Usually you do not need to do any stem cell treatment for the Achilles tendon. So yes, basically any tendon problem in the body is really responsive to PRP. Generally, you don't have to. So whether we're talking about the Achilles tendon, whether you're talking about the rotator cuff tendon, the medial or lateral epicondylitis, that's the flexor tendons and the extensor tendons of the elbow, very common. That's golfer's elbow or tennis elbow. Plantar fasciitis. These are all different kind of tendon sports injuries problems that respond really well to PRP. Again, generally not needing to go on to a stem cell procedure. All right, again, seems like we're winding down here, and I want to thank everybody for joining me tonight. I hope this was informative. I know this is just a small introduction. The main benefit of tonight's webinar is to give you a little briefing of what we have here. I please recommend going to our website where there's a ton of information, a lot of testimonials, a lot of data, and then most importantly, come in and see us for a new patient evaluation, and we will be happy to go over all of your questions in specific detail with your exact problem. So once again, I want to thank everybody for joining me tonight, and have a great day, and let us all be on the beach sooner rather than later. Have a great night.